Hi, I'm Jack Cush. I'm here at RWCS 2019 in Maui. We're going over the poster sessions with the fellows, and I'm here with Allison Wildin. Allison, where are you from?
I'm originally from Indiana, but I'm currently training in Milwaukee, Wisconsin at Medical College, Wisconsin.
Okay. You've got a really interesting poster here, which I think would confuse most doctors, and that is GPA as a diagnosis, but ANCA negative. Tell me about the case.
Yeah, that's correct. So we had a kind of an unusual case of an atypical demographic in a gentleman with limited GPA, limited only to the lungs, and it was ANCA negative. He presented with about 4 months of this dry cough and then about a month of this pneumonia that wasn't responding to broad-spectrum antibiotics or antifungals, had a completely negative infectious workup, and just wasn't responding. So we had a very broad differential diagnosis, and we were working him up, and eventually got a biopsy which showed demonstrated granulomatous inflammation in the lung and vasculitis consistent with GPA.
This is a transthoracic needle, or you went for tissue?
We went for tissue. He had a wedge biopsy.
Okay, good. And up until that point, describe how sick the patient was. What his main symptoms were? Respiratory, and that's it?
Respiratory. He had progressive shortness of breath and cough. Eventually, by the time he presented to us, he was requiring oxygen, and he was febrile. He was tachycardic. He ended up intubated after his wedge resection as well.
So is this a case where when the pulmonologists don't know what to do, they call the rheumatologist, and that's how you got involved?
That is correct.
Yeah. And were there other clues that this was going to be an inflammatory and not an infectious disorder?
No, not really. He had no other manifestations of GP. He had no renal disease or rashes or any other manifestations that would suggest a vasculitis other than these lung infiltrates that wouldn't resolve.
And so once you did the biopsy, then what did you institute as far as therapy?
So we started him on pulse dose steroids and cyclophosphamide as well as plasmapheresis.
Why that?
That's the standard of care in our institution for this disease.
Okay, so you're not using rituximab?
We do. In fact, we're planning to use rituximab for his maintenance therapy.
Okay, very good. So is basically the bottom line here is that if you really think you have the diagnosis but you don't have the ANCA, you have to go for tissue?
I think so. I think you have to have a very high level of suspicion in these cases when you can't explain what's going on with the patient and keep a broad differential, and you can't rule out GPA based on the absence of an ANCA.
Yeah, that's an important teaching point. Can you talk a little bit about just the diagnostic criteria and how the diagnosis should be made?
Sure. So part of the problem is we don't have great diagnostic criteria. We have the old 1990 criteria for the classification of Wegener's granulomatosis.
Wait a second, it's 2018. We might be behind.
Correct. We're a little bit behind. And they actually were created before ANCA testing was available. And currently there's a study being undertaken by a combination of EULAR and ACR to create new, better diagnostic criteria for vasculitis.
So that'll be really important, especially diagnosis like this. So how much after the diagnosis, what's the history after? How was the patient done?
Yeah, so he responded very well to treatment. He was extubated within a week, and at this point he is finishing his cyclophosphamide, and his lung function seems to be back to normal, and he's doing fairly well.
He's out of the hospital?
He is out of the hospital, yes.
Interesting case. Thank you very much for bringing it.
Thank you.